Hello, my name is Philip Chen. I'm a professor of otolaryngology and also a rhinologist in San Antonio, Texas. Uh, I have the fortune of discussing with you today the effect of chronic rhinosinusitis with nasal polyps on quality of life. So as a rhinologist, of course, as I try to get my patients to feel better, this is a very important aspect of the way this disease process affects our patients. Before I get started, though, I want to thank the program committee and, of course, the organizers for inviting me. I've heard great things about this meeting previously, and I'm excited to participate this year. I have relationships with GSK and Sanofi, who are both active in nasal polyp research and in treatments, but this talk today is not about either of these. Our objectives today are to list the cardinal symptoms of chronic rhinosinusitis with nasal polyps, as well as to discuss the symptoms that patients most complain about and the ones they find most problematic. In addition, we want to understand some of the measurement tools that are used to evaluate quality of life. And finally, we want to discuss how extra-rhinologic symptoms affect patients suffering with chronic rhinosinusitis with nasal polyps. It's easy to think of nasal polyps just being located in the nose and therefore affecting patients' breathing and maybe something in the facial region, but it goes so much farther than that. Chronic rhinosinusitis is a syndrome more so than a specific disease. It is likely multifactorial in etiology and likely results from dysfunctional interactions between the host immune system and the various environmental factors leading, in the end, to inflammation and the symptoms that come with that. There are many different things that have been implicated as predisposing factors leading to chronic rhinosinusitis. Those include things like allergy, asthma, and immune deficiencies. Some of that makes sense, especially if we think about the inflammatory pathway, especially type 2 inflammation. But there are other things like reflux, anatomic variations, ciliary impairment, as well as smoking and pollution that may also predispose patients to developing this inflammation within the sinonasal passage. And ultimately, this inflammation results in significant impacts on a patient's quality of life. Chronic rhinosinusitis is defined as having at least two of the following symptoms persisting for at least 12 weeks. A patient may complain of nasal obstruction. They may have nasal drainage, and that includes both anterior drainage as well as posterior nasal drainage, like postnasal drip. They may also complain of facial pain, or more commonly facial pressure, as well as loss of smell or a decreased sense of taste. But in addition to these subjective findings lasting more than 3 months, patients also have to have objective findings because subjective symptoms alone, while having sensitivity over or close to 90%, the specificity of these symptoms alone is only 12%, with a positive predictive value of about 40% and a negative predictive value of about 65%. So it's important that in addition to the symptoms, that leads us to doing additional workup with objective CT scans or nasal endoscopy or both. And when we do these additional measures, we expect to see inflammation or purulent mucus, as well as mucosal thickening. Now, if the patients fulfill all of these criteria above, and they have no nasal polyps seen in the middle meatus, then they have chronic rhinosinusitis without nasal polyps. But if they have nasal polyps in the middle meatus, as demonstrated in this picture here, then they have chronic rhinosinusitis with nasal polyps. And that's what we'll be focusing on today. Inflammation is important to get under control so that the patients can hopefully feel better. Inadequately controlled sinusitis is defined as 3 or more of the following that occur for most days of the week. So while diagnosis only requires 2 of these subjective complaints to be considered inadequately controlled or uncontrolled, you need to have 3 or more of these symptoms of blockage, drainage, pressure, sense of smell or taste impairment. And then notice this one also includes sleep disturbance or fatigue, which was not in the diagnostic criterion. In addition, while chronic rhinosinusitis requires 3 months to have the diagnosis, greater than 6 months of ongoing symptoms with periods of exacerbation would be considered inadequately controlled. And just like when we diagnose the disease process, one has to have objective evidence with endoscopy with diseased mucosa. And I believe a CT scan would be appropriate as well to consider a patient uncontrolled if their symptoms were ongoing. Chronic rhinosinusitis is a process that affects people around the world. It's not just something limited to North America, but every continent has patients who suffer with this process. Roughly about 10% of the population suffers with chronic rhinosinusitis symptoms, and the number that actually have sinusitis may be slightly lower, as demonstrated by some studies that look at CT imaging. This overcall on the prevalence of sinusitis may be secondary to many overlapping symptoms. For example, allergies may have nasal obstruction as well as runny nose. Migraine will have facial pressure. Septal deviation can also have nasal obstruction as well. So as I alluded to previously, the sensitivity of these symptoms catches patients with sinusitis pretty well, but the specificity is not very good. And that goes to show the importance of objective findings, not only subjective findings. Of the patients that have sinusitis, approximately 20% of them have nasal polyps. So therefore, in the total population, roughly 2% of the population have chronic rhinosinusitis with nasal polyposis, and this is pretty similar regardless of what part of the world a person is. It's pertinent to note that the word polyp is nonspecific. It merely means that a growth is on a stalk. And a lot of patients, when we say the words nasal polyps, they get nervous because they think of colonic polyps and they think potentially there's any kind of malignant potential. Fortunately, chronic rhinosinusitis with nasal polyps has no malignant potential, and that's good. But unlike colonic polyps that stay locally and are fairly asymptomatic, nasal polyps actually have a pretty dramatic effect on a person's quality of life. And because these small pesky polyps have such a significant impact on our patients, there's quite a bit of a societal cost as well. In fact, when it comes to acute and chronic rhinosinusitis, the United States spends about $11 billion a year in healthcare costs. Why so much money? Well, these small little fleshy polyps that are confined to the nose, they still exert a dramatic effect on the patients. And people will do whatever it takes a lot of times to try to feel better, whether it's medications, imaging, testing, workups, whatever it may be, people just want to feel better. And that's important because we want them to feel better too, because there's a roughly 61 million workdays missed per year in the United States secondary to sinusitis. So the effect of absenteeism is very important to society, and it results in about $13 billion a year in lost productivity. In addition, patients that have chronic rhinosinusitis with nasal polyps spend over $1,000 more in direct medical costs per year compared to their counterparts that do not have nasal polyps. So this is an expensive disease that takes a real toll on the patients, but also has an effect on society. So I've made the statement a few times that nasal polyps have a significant effect on a patient's quality of life. One might ask, am I being overly dramatic since I'm a sinus surgeon that I think polyps are so important and that it's really affecting people more than it really is? Well, in order to determine that, patient-reported outcome measures, or PROMs, are regularly used to determine how a disease affects a person's quality of life. These are validated surveys, some of which are for specific conditions such as sinusitis, but others that measure global health-related quality of life. And they can be used for a range of medical conditions ranging from dementia to heart disease to orthopedic injuries and pretty much anything else. In the realm of sinusitis, the most commonly used patient-reported outcome measure is the 22-item sinonasal outcome test, affectionately known as the SNOT-22. And this is a validated survey of 22 questions rated from 0 to 5 about how various symptoms affect a patient's day-to-day functioning and how they feel. So from 0 to 5, scores go up to 110 points. There's also the chronic sinusitis survey, as well as the rhinosinusitis disability index. These have been validated for chronic rhinosinusitis patients as well, although I don't see them being used quite as often recently. There is no standardized survey for nasal polyp patients specifically, so we typically use the same outcome measures regardless of whether they are patients with or without nasal polyps. In addition, when we talk about all the various symptoms of chronic rhinosinusitis with nasal polyps, there are a few surveys that actually look at the individual symptoms with validated surveys and with that kind of deep granularity. The two exceptions would be sleep and mood, both of which have multiple surveys as well. So the quality of life scale was one of the earliest quality of life surveys. This was a 16-item instrument from the 1970s that measured 5 domains of quality of life: physical well-being, relationships, personal development and fulfillment, societal activities, recreation, and independence. The WHO survey has been translated to 40 different languages and helps across various cultures to see how disease processes may affect people of different backgrounds. There are similar qualities assessed as the quality of life scale, so they're both rather useful. Recently, I've seen more often used the SF36, which is a 36-item patient-reported survey of quality of health, and it summarizes patients' perceptions of their health and their well-being. It has 8 scaled scores, which are weighted to determine how disabled a patient is secondary to their disease process, with a lower score meaning more disability. And this looks at vitality, physical functioning, bodily pain, general health perceptions, physical functioning, emotional functioning, and social functioning, as well as mental well-being. Interestingly, the SF36 does not include sleep. Recently, the SF6D is a shorter form of this, which has also been validated and is a little bit easier for researchers to use. So I've mentioned earlier that chronic rhinosinusitis with nasal polyps doesn't just affect the nose, that it affects an overall patient's well-being. And using that validated SF6D survey that I just alluded to, it suggests that chronic rhinosinusitis patients can have severe effects on overall quality of life. And this is similar, as seen in this chart here, to CHF, COPD, and Parkinson's disease. In addition, these patients have a higher rate of feeling tired, having poor sleep, and feeling depressed. In this particular study, the good news is that patients had significant improvement in quality of life after surgery. And after all, that's why many of you are at this conference, because we want to see how we can get our patients to feel better. But this was fairly striking to me to see these results and to think that sinusitis patients suffer as much as these other very well publicized and significant diseases affecting patients. If patients have 4 or more symptoms, that increases the potential that these patients actually do have chronic rhinosinusitis. However, the symptoms, whether it's with or without nasal polyps, are basically the same: nasal blockage, rhinorrhea, postnasal drip, facial pain or pressure, and hyposmia or anosmia. So nasal obstruction seems to make sense if patients have polyps, they're blocking someone's breathing. But these other symptoms can affect patients quite a bit as well. For example, rhinorrhea, patients may feel embarrassed because they're always using tissues or blowing their nose. Maybe their nose is irritated and red because of that. And then people always think they're sick or they sound congested or concerned that they're infectious. Similarly, postnasal drip can lead to lots of cough. And as we know, with the recent pandemic and the cough and the concerns that people were infectious, this can make people very nervous when patients with sinusitis have this significant dramatic cough. So this can also affect people's well-being. Nasal blockage is very sensitive, but it's not very specific for chronic rhinosinusitis. Allergies, large inferior turbinates, deviated septum, they can all lead to nasal blockage. Yet many patients consider nasal obstruction their most problematic symptom. So it's important that we try to address it. In fact, I recently had a patient who called us in a panic and said she felt like she was going to faint and that she had to go to the emergency room because the nasal obstruction was leading to mouth breathing, and this was causing her so much anxiety. So this really can be problematic for people. And we all know when we've had colds or when allergies strike, it's very uncomfortable to breathe through a person's mouth. The nasal passage does an amazing job of humidifying the air we breathe. This is more natural and it's much more comfortable for us. Mouth breathing, though, leads to dry air and dry mouth, and that is relatively uncomfortable. It can affect our sleep. It can make it hard to chew when people say that they have to chew with their mouth open, which is embarrassing, especially when they're eating with others. And they sound stuffy, and people oftentimes ask them if they have a cold, and that can get a little bit old and frustrating. Facial pain and pressure is commonly described as well for these patients. It saps their energy, they don't feel good, and they have a decreased desire to be very active. But it is notable that chronic rhinosinusitis patients don't typically have ongoing and regular headache. This oftentimes is a less significant symptom for these patients, although they may notice that there's more headache when they have exacerbations of their sinusitis. And in fact, if patients have facial pain without significant other rhinologic symptoms, it actually suggests against sinusitis, as noted from some other research studies. So if a patient comes in saying sharp, stabbing pain, and they have no nasal obstruction, they don't really have too much rhinorrhea, one should really be looking at something other than sinusitis in these patients. Because migraine headache, for example, is much more common in the average person than sinusitis, which is, as we mentioned earlier, about 10%. Migraine is higher. Olfactory dysfunction is probably present in about 60 to 80% of the patients with chronic rhinosinusitis. The COVID-19 pandemic shed a whole lot more light on this problem. Previously, our patients thought it was kind of odd that they had loss of sense of smell or taste, but now we know this is actually relatively common, especially amongst those who have suffered with the COVID-19 virus. Loss of sense of smell is actually having the highest specificity for chronic rhinosinusitis. And patients with chronic rhinosinusitis and nasal polyps with anosmia have even more decreased quality of life and have higher rates of depression and anxiety. So once again, it goes to show the importance of trying to help our patients to smell better so that they can feel better, overall. There are multiple different ways to test someone's smell. Of course, you can just ask them. You can do a visual analog score to see from 0 to 10 how bad is their smell. But there are also objective smell tests, such as the UPSIT, University of Pennsylvania Smell Identification Test, or sniffing sticks, which are objective scales that patients can use to determine just how affected their sense of smell is or is not. But the olfactory dysfunction, affects a patient's ability to detect flavors as well. Now, here in Texas, we just had our new Michelin guide come out, and so hopefully some of you, while you're in Austin, will get to enjoy some of the culinary treats of Austin. But think about these patients with sinusitis and nasal polyps who can't enjoy that as much. And we know that eating is a very social activity in nearly all cultures. So not being able to do so can make patients feel isolated and decrease their quality of life. In addition, patients may feel embarrassed or anxiety because they can't tell whether or not they have good hygiene or not. They can't tell if potentially they need to wash or need deodorants. In addition, it's a danger to the patients because they cannot smell smoke and they may not be able to detect when food has gone bad and can get food poisoning from that. So it's important in the way we interact with the world around us to be able to have a good sense of smell, and these patients oftentimes do not. And even many doctors think that chronic rhinosinusitis with nasal polyps is primarily a disease affecting the nose, maybe the head, the neck, but it does go a whole lot farther. As I kind of alluded to earlier, those symptoms within the head and neck area can lead to a lot of extra sinus disease manifestations: fatigue, body pain, sleep dysfunction, cognitive dysfunction. If you're not sleeping well, it's hard to stay awake for my talk, for example, or it's hard to learn something new because you're very sleepy. And also, when you're tired, you don't want to go out, and so that may lead to isolation and depression. So chronic rhinosinusitis affects the psychological well-being and mental health of these patients, leads to a lot of frustration, depression, anxiety, hopelessness, and embarrassment. So once again, it just goes to show how important it is for us to try to manage this disease process so our patients can feel better. Fatigue and depression is present in about 50% of patients with chronic rhinosinusitis. And those with comorbid depression and sinusitis have even worse overall quality of life and more severe symptoms. Bodily pain is also noted to be greater in patients with chronic rhinosinusitis, and depression, as we mentioned, is also worse. If the patient has worse olfaction, that also correlates with worsening depression as well. But the good news, if there is some here, is that after surgery, patients that have chronic rhinosinusitis do improve with their overall quality of life to a similar degree as those without depression, although their overall scores are still lower. Regardless of the various sleep surveys that are used, the impact of chronic rhinosinusitis on sleep is clear, and there are significant sleep problems suffered by these patients. Chronic rhinosinusitis patients report worse sleep on surveys, and in fact, they report that their sleep is worse than many other chronic conditions and is tied with COPD, and only cirrhosis patients report worse sleep in one of the surveys looking at various chronic diseases. Sleep dysfunction is very common in patients with sinusitis, and the sleep domain is similar among CRS patients to patients with obstructive sleep apnea, with frequent nighttime wakenings, not feeling rested, and overall fatigue. In addition, a large percentage of these patients also report daytime sleepiness. It is important to note here that chronic rhinosinusitis does not cause sleep apnea. There have been multiple studies that have demonstrated this. It is something that gets confused with patients sometimes because they are not sleeping well, and so they think that their symptoms are very similar to OSA. But multiple studies have demonstrated this is not the case. It doesn't mean we won't want to help our patients. Of course we do. We want them to feel better and to sleep better. And remember, patients can have comorbid OSA and sinusitis, and you would treat them separately and independently of one another. Chronic rhinosinusitis is one of the top 10 diagnoses associated with lost productivity. Of note, they did not look at smartphone usage as one of those diagnoses of lost productivity. In a national database study, Zhao and colleagues found that 22% of CRS patients had depression, and that's versus about 16% of the overall population. These patients also suffered with worse sleep and more missed work, which affected their productivity. In another study out of Utah, a cross-sectional cohort study was performed, and they noted that there was about 64 days of lost productivity per year. that was split into 20 days of missed work per year and 44 days where the employee was present, but not really present in the sense that they weren't productive or they weren't very able to do their normal activities. And so the patient shows up, they come to work, but they're really not functioning the way they're supposed to. So that really can affect someone's work and their productivity, and that leads to about $21,000 per year of lost productivity. So the presenteeism actually may be a bigger problem than absenteeism. Chronic rhinosinusitis with nasal polyposis is typically a result of type 2 inflammation. At least it is in North America. As a result, a lot of these patients also suffer with other comorbid type 2 inflammatory diseases like asthma, with patients suffering comorbid asthma in about 56%, up to 56% of nasal polyp patients, allergy in up to 77% of patients, and allergic rhinitis in up to 76% of the patients. In addition, a lot of these patients that suffer with allergy may complain of worsening sinus symptoms during their bad allergy seasons. Now, whether or not this is a true exacerbation of their sinusitis or whether it's due to the overlapping symptoms from the inflammation of the upper airway, that's a bit unclear. But what is clear is that patients suffer more during these times of the year. Patients with other eosinophilic comorbid diseases with their nasal polyps, such as eosinophilic asthma, have more severe disease as well as more recalcitrant disease. They have worse symptom severity as measured by the SNOT-22. Oftentimes, these patients have more surgeries than their counterparts that don't have the same eosinophilic inflammation. And these patients also take more courses of systemic steroids, which suggest that their disease process is not under as good of control, requiring the increased number of steroid doses. These patients have more impaired quality of life. They have loss of productivity in greater amounts than their counterparts as well. Patients with chronic rhinosinusitis and nasal polyps with comorbid asthma had worse asthma severity, but fortunately, after being treated, they actually seemed to do quite a bit better. And they had reduced inhaled steroid usage, reduced ER visits, peak expiratory flow and nasal inspiratory flow was improved as well. So while these patients oftentimes have more severe disease and worse disease, it seems that by managing the upper airway sinusitis, there can be benefits downstream with the lower airways as well. Some of the most challenging patients to take care of are the aspirin-exacerbated respiratory disease. Those patients have the worst reported quality of life scales. Their polyps oftentimes come back, and it's very challenging to manage. And these patients oftentimes are given many courses of oral steroids. So this is always important that your patients with nasal polyps and allergies, that we always ask them about their ability to take NSAIDs or even sometimes Tylenol can affect that as well. Currently, there is no cure for chronic rhinosinusitis with nasal polyps. However, there are things that patients can do to help them feel better. And using SNOT-22, which reflects the patient's quality of life, there have been noted improvements in all of these their sinus symptoms when treatment starts. This includes sinus irrigations, topical nasal steroids, systemic steroids. For patients with aspirin-exacerbated respiratory disease, aspirin desensitization may be good as well. And then more recently, biologics have become a hot topic in chronic rhinosinusitis with nasal polyps, and they have some promising results there as well. Surgery helps our patients quite a bit. Not only does it remove the polyps mechanically so that people can feel better, it also opens up their sinus passages so that the topical steroids that we place in there can actually reach their destination and try to prevent the inflammation from coming back. And when the inflammation doesn't come back, that also helps our patients to continue to feel good and to have improvements in their quality of life. That quality of life is not just in the nose, but also those extra-rhinologic things that we mentioned, such as sleep, depression, fatigue. Those also demonstrate improvement after treatment with these interventions. Thank you for listening to this talk on chronic rhinosinusitis with nasal polyps and its effect on patients' quality of life. I hope you learned something, and I look forward to seeing you soon in Austin.